To all my sisters who have been exercising, been working out, trying to lose weight, but no result, but I've come to help you. I'm going to tell you things that you believe about exercise that is not really so. They are myths. And here is number one. That you believe that the more you sweat, the more fat you burn. So let's clear it up. Sweating does not equate fat burning. In fact, sweating is just your body cooling itself. You can sweat sitting under the sun and you are burning zero fat. Fat burns when your body uses energy over time, and that happens through movement and breathing, not through dripping sweat, right? So wearing heavy sweaters, you are not losing fat. What matters is consistency, activity, and reduction in the amount of food you are taking. That's all. Now, for the elderly people, some of you believe exercise is only for young people. You want to lose weight, but you feel like you are too old. Nope. It's a very common myth, but the truth is that exercise is not just for young people. Older people actually need it more because it keeps the joints moving and the muscles strong, right? So if you're older, just know that exercise will help improve your heart, improve your joints, and your brain health. All right, age doesn't stop exercise. Rather, wrong exercise is what is not good for you. Now, myth number 3 about exercise is that pregnant women should not exercise during pregnancy. Guys, pregnancy is not a sickness. Pregnant women can exercise safely with proper guidance. It's very beneficial. You know, in fact, it reduces back pain, it reduces swelling, it improves circulation, it helps with delivery and even recovery. Okay, let me now bust your brain. For a pregnant woman to be resting all the time is not healthy. Unsafe exercise is also not healthy. So what do? You consult your physiotherapist and exercise all the time. Another myth that people believe about exercise is that after delivery, women should not move. See, many people believe that new mothers must not move. This is very wrong. Complete bed rest is not advised. Rather, gentle moving is what will help healing because it improves blood flow, it reduces body stiffness, it prevents blood clots. Walking is very important, although overdoing it is not good. So don't say you don't move at all, rather you move in a measured manner. Also, myth 5 is that exercise causes miscarriage. This is a big myth that causes unnecessary fear. The truth is that normal exercise does not cause miscarriage. Most miscarriages have medical causes, not physical activity. Safe exercise supports pregnancy health. It improves oxygen flow. It helps control your weight. It is intense exercise that is not good for you, right? Myth number 6 is that people with high blood pressure should not exercise. Guys, I have a patient I'm seeing. Every time we engage in physiotherapy exercises, his blood pressure drops down. So before we start, it usually reads around 140 something or 150 something. But once we are done, we'll check it again. You'll be getting 125/70. So that myth is not true. Guided exercise is really good for your cardiovascular health, your heart, okay? And myth number 7 is that exercise is dangerous for heart patients. Guys, heart patients often fear exercise, but complete rest is actually what they should fear. Controlled exercise strengthens the heart. It improves endurance, it reduces complications. I mean, cardiac rehabilitation, it exists for a reason. Okay, so exercise must be supervised but not avoided. Okay, so let's be guided. Myth number 8 is that stretching once a week is enough. Guys, flexibility does not work that way. Stretching once a week is not enough. Muscles tighten on a daily basis, so they need regular stretching, especially if you engage in exercise. Always stretch before every exercise, okay? And myth number 9 is that pain means that your exercise is working. Guys, pain is not a goal. Pain does not mean progress. Good exercise can feel challenging, but it shouldn't feel painful. If you're lifting weights and you feel sharp pain, it's a warning sign to stop, all right, and find what you're not doing right. So no pain doesn't mean failure. It means you're doing the right thing. Myth number 10 is that you are too old to exercise. Guys, you are never too old to move. Age is not a limitation. Inactivity is a limitation. All right. Exercise maintains independence, activates your muscles, protects your joints, it boosts your confidence. I mean, so movement is lifelong. All right. Good. Now, myth number 11 is that exercise will cause your bones to break. Many people fear exercise because of bones, but movement doesn't break healthy bones. In fact, bones grow stronger with movement. Exercise improves your bone density. All right, weak bones come from inactivity, not controlled movement. So proper exercise, it protects your bones. Remember, wrong technique can also cause injury, but not exercise itself. All right. Myth number 12 is that no pain means you are not doing it right. This belief is very misleading, guys. Exercise doesn't need to pain you in order for it to work. Progress comes from consistency, not from suffering. All right, you can improve your strength and flexibility without pain. Okay, usually it means you are overloading your muscles if you're always feeling pain when you're doing exercise. So please, let's be guided. And myth number 13 is that exercise can correct bone deformities. Exercise cannot change bone shape, guys. Bone doesn't bend because of exercise. So bones don't bend because of exercise, but movement improves function. It strengthens surrounding muscles, improves your posture, and reduces your pain. It improves daily movement. So that's the benefit, not reshaping of bones. All right. And then myth number 14 is that exercise makes you shorter. Guys, exercise doesn't reduce your height. This is a very common fear. Good exercise improves your posture. It reduces slouching. It strengthens your spine, reduces poor posture. But then it's not exercise that makes you have a shorter bone. All right. So that is it. Myth number 15 is that people with asthma should avoid exercise. Nope, asthma doesn't mean no exercise. Avoiding activity weakens the lungs. So controlled exercise improves your breathing, even as an asthma patient. It increases lung capacity, it builds tolerance. Warm-up is also very important. So movement is very beneficial. It is not harmful. Exercise wisely. Myth number 16 is that exercise makes you infertile. This myth scares many people. You see, normal exercise does not cause infertility. Moderate activity balances hormones. It improves blood flow. It supports reproductive health. If you're having erectile dysfunction, there are exercises you can even do to improve your reproductive health. All right, but remember, balance is key. And that is it. So myth number 17 is that exercise during menstruation is harmful. No, exercise during periods is safe. It doesn't damage the body. It can reduce cramps. In fact, it improves your mood. It reduces bloating. Energy levels may vary. All right, but make sure you rest when necessary. Movement helps many women. Okay, but listen to your body. Myth number 18 is that sleeping with a belt on your stomach causes weight loss. Waist belts, guys, don't burn fat. They only make you sweat. And sweating is water loss, not fat loss. So once you drink water, weight returns. So fat loss need movement and proper eating habits. No shortcut exists, okay? I'm sorry, but that's the truth. And myth number 19 is that the more weight you lift, the faster you recover. Guys, more weight doesn't mean faster recovery. Recovery depends on rest, nutrition, and sleep. Proper progression is what matters. So if you don't rest between lifting weights, you are increasing your risk of injury. All right. And the last myth number 20, is that elderly people should avoid bending or stretching. No, elderly people need movement. Avoiding bending causes stiffness. Avoiding stretching reduces mobility. Gentle movement maintains independence, prevents joint pain, it improves balance, and movement should be controlled, not avoided. So that is it, guys. Remember to like, subscribe, and share this video. Ciao.